I am here today joined by Dr. Charlotte deCourcey, who's going to be one of the speakers at our sleep presentation or sleep afternoon on the 26th of June. And you're a holistic dentist.
Mm-hmm.
Why did you get into sleep medicine? You've done a postgrad in sleep medicine.
Yeah, thanks, Brett. So I've been a holistic dentist since 1993. Yes, we don't mention these numbers. And my journey originally, where I met you way back, was the chirodontic world and the understanding of the importance of dentistry and dental approach to whole body health.
The links.
The links, yep. And spinal pain and rehabilitation of the jaw joint. And that got me a long way in treating my pain patients, but it didn't get me the whole hog. And along the way, various little lights started to switch on that I identified patients who were suffering more chronicity with their pain, were struggling to recover, were generally people who weren't sleeping well. And there's a lot of literature that's come through in the last 10 to 15 years that shows us that link between poor sleep quality, perhaps sleep deprivation, but poor sleep quality alone will do it, and persistent pain and increased levels of pain, increased levels of inflammation. The body heals during sleep. I think people have that concept well and truly down pat, but what they might not be aware of is that time in bed, meaning total hours in bed, doesn't necessarily correlate to quality of sleep. And it's not enough to say to people, do you sleep? You've got to dig deeper than that when you're dealing with a pain patient, and that's what got me into that area. And consequently, I did a master's in sleep medicine with Sydney University, and Colin Sullivan, the developer of the CPAP machine, who people may be aware of, possibly one of our most important sleep physicians in Australia and the whole world, in my opinion.
So in your sleep presentation, you'll dive into some of what you've been talking about, which is the sleep architecture, some of the connections on how CPAP works, titration, getting the levels right, and how that improves not only quality of sleep, but in fact improves other parts of their life, including their experience of pain.
For sure, and just simple tips on how to identify the patients who really you need to delve deeper. What simple screening tools are there that you can employ in your practice that will help you to identify these people? And of course, the old adage, if you're going to ask the questions and you're going to find out the answers, then what the heck do you do with the results? So I'm going to help a little bit with what's the natural progression of how to treat those people, what are their options, so that you can give them a little bit of insight into what might be going on, who's going to help them, and what might the path be.
Great. We look forward to hearing from you. That'll be the 26th of, I was almost going to say January, 26th of June for the Saturday afternoon. We'll see you there.